What are the stages of hair loss and how does it look? Hi, I'm Clarissa from OurDoctor, and I'd like to discuss the different stages and types of hair loss with you. One of the big questions people ask both men and women is, what stage is my hair loss in and how long do I have before I go bald? Now the good thing is hair loss is most likely to be a gradual event that usually starts on the top of the head, the most common type of hair loss affecting people as they age. In men, hair often begins to recede at the hairline on the forehead, whereas women typically have a broadening of the part in their hair. An increasingly common hair loss pattern in older women is a receding hairline, known as frontofibrosing alopecia. As you age, you may also notice circular or patchy bald spots on the scalp or thinning by the part. Some people lose their hair in clumps or patches on the scalp, but you may also notice your beard or eyebrows thinning. When this occurs, you may notice your skin is awkwardly itchy or painful before the hair falls out. Before getting started with treatment, you should ask yourself a few questions. Was this event suddenly, or did you make any hair grooming changes or even go through any emotional changes? Also, are you losing hair anywhere else on your body, or does your skin look discolored, or is it swelling or oozing? Contact a medical professional to get an expert's opinion if you feel uncomfortable. The stages of hair loss are generally not noticeable at first, but over time they can become more advanced and much more noticeable. In most men, you'll notice minimal changes to your hair over time and not usually all of a sudden. In men, hair loss can begin at any time after puberty and progress over years or even decades. It starts above the temples and continues around the perimeter and the top of the forehead. There is often a ring of hair along the bottom of the scalp. Many men with male pattern hair loss eventually become bald. There are some symptoms to watch for. Firstly, you may experience small amounts of hair thinning. Second, you may also notice an M-shaped hairline. Thirdly, visible balding and recession of the hairline would look like a U or V shape. Fourth, extensive hair loss at the back of the head. Fifth, you'll see a horseshoe U-shaped hairline at the crown, also a visible scalp and a larger bald patch on the scalp. Lastly, you could see a recession to the crown with minimal thin hair. In women, hair loss progresses differently than that of a man. In women, hereditary hair loss usually starts after age 40, and most notice their hair loss by the time they turn 50. It usually occurs in fits and bursts and begins gradually at the part line, followed by increasing strands of follicles breaking and radiating from the top of the scalp. Hair loss can be frustrating as it has a significant impact on us, but in recent years, I've seen many resources and products to help cope with this problem. So the good thing is that most hair loss is treatable and you can return to your routine without emotional distress. There are several types of hair loss stages and conditions, so I'll be as brief as I describe each one. Some of the more common types of hair loss include androgenic alopecia, the most common type of hair loss, which affects more than 50 million men and 30 million women in the United States. Telogen effluvium is a scalp disorder characterized by non-scarring diffuse hair loss from the scalp after a triggering event such as major illness, surgery, or severe stress. Anagen effluvium is a non-scarring alopecia commonly associated with chemotherapy or other toxic events. Alopecia areata is also called AA, a medical term for bald or patch hair loss, usually brought on by your immune system or by severe stress. Tinea capitis is a fungal scalp infection caused by mold-like fungi, which can be very contagious and persistent. Antifungal medications are required to treat this infection. Cicatricial alopecia is an inflammatory condition that destroys the hair follicles, known as scarring and permanent hair loss. This irreversible damage to the epithelial stem cells located in the bulge region of the hair follicle. Hair shaft abnormalities are when you notice changes in the color, density, length, and structure of your hair, or alterations to your hair fibers and cuticles may lead to brittle and uncombable hair. There are some types of hair loss such as lichens planopilaris is a type of alopecia linked to your body's immune system. T lymphocytes, a type of white blood cell, usually cause skin conditions that attack the hair follicle from the source. As a result, the scalp may become red from irritation and may become itchy and painful, or small bumps may form. This condition is more common among men than women, but the good thing is your doctor can prescribe medications to stop hair loss. Discoid lupus erythematous is a type of cutaneous lupus in an autoimmune disease affecting the skin. It can lead to inflamed sores and scarring on the ears, face, and scalp. Hair loss is one symptom of the disease, and when scar tissue forms on your scalp, hair can no longer grow in that area. Folliculitis decalvans is hair loss defined as an inflammatory disorder that leads to the destruction of hair follicles, accompanied by redness, swelling, and lesions on the scalp that may be itchy or contain pus, known as pustules. This type of hair loss is not reversible, but dermatologists can offer medication to control symptoms and in some instances, stop the progression of hair loss. Our doctor can prescribe medications to control folliculitis decalvans symptoms, and you can call us anytime if you have any questions regarding treatments. Frontofibrosing alopecia mostly commonly affects postmenopausal women. It typically occurs in a receding hairline pattern and may also result in hair loss in the eyebrows and underarms. Researchers believe an autoimmune reaction in which genetics and hormones play a role in hair loss, but it's unknown. Centrifugal cicatricial alopecia. This hair loss comes from using different hair products and techniques that damage your hair follicles. Hair relaxing products usually cause this infection, blow dryers, curling irons, and even hair extensions. This can also be caused by the constant use of gels, pomades, or other types of scalp oils you use. However, centrifugal cicatricial alopecia can be avoided once you stop using these products and hairstyling tools. Hypotrichosis is the rarest form of hereditary hair loss without other abnormalities, and it usually starts in early childhood and progresses with age. So now you may be asking yourself, when should you see a doctor? You should go to your doctor if you or a loved one are distressed by persistent hair loss and want to pursue treatment. Again, talk to your doctor if you notice sudden or patch hair loss or more than usual hair loss when washing or combing your hair. Older women's most common hair loss pattern is frontofibrosing alopecia or a receding hairline. For men, the most common type of hair loss is androgenetic alopecia, which usually occurs with gradual thinning on the top of the head. However, if your hair loss is sudden, you may need to get checked for an underlying medical condition that requires in-person treatment. There are 5 different types of alopecia. Alopecia areata or patchy baldness. This type of androgenetic alopecia is the most common type of hair loss, affecting more than 50 million men and 30 million women in the United States. Commonly known as male or female pattern hair loss, androgenetic alopecia is hereditary but can be managed with medication or surgery. Persistent patchy alopecia areata. This hair loss is characterized by patchy scalp hair loss that continues over a long period without ever developing into extensive alopecia areata, such as totalis or universalis. This hair loss can also be genetic but may come from certain health conditions such as Down syndrome, vitiligo, or thyroid disease. Alopecia totalis is a chronic condition of complete hair loss of the scalp, which affects a small percentage of patients with alopecia areata. The best treatment for this disease is to recognize it early on in its course and get treatment options as soon as possible. Alopecia universalis is characterized by the complete loss of hair on the scalp and body. It usually comes from an advanced form of alopecia areata, which is a condition that causes round patches on your skin. Some test treatments are topical corticosteroids, intralesional corticosteroid injections, topical immunotherapy, or minoxidil. Diffuse alopecia areata is a rare alopecia areata described predominantly in young women. In cases of alopecia areata incognita, the typical patchy distribution of hair loss in classical alopecia areata is absent, but abrupt and intense hair loss is characteristic. Ophiuchous alopecia is a subtype of AA that presents as a symmetric band-like hair loss pattern of the scalp's occipital, temporal, and parietal regions. Alopecia areata ophiuchous is a form of alopecia areata that affects the back of the scalp and the areas behind the ears. I highly recommend using a supplement such as PeakBody's hair growth support for men or women for most types of hair loss. This product supports your hair strength, health, and growth and contains essential ingredients such as biotin, silica, and collagen, which your body needs to stimulate and strengthen your follicles. The suggested use is 2 tablets daily, preferably with meals or as directed by a doctor. This product contains no fillers and is non-GMO and GMP certified. Also, check with one of our specialists standing by at OurDoctor for other prescription and over-the-counter options that may be suitable for you. I hope I have provided you with some information on the stages of hair loss. However, there is still so much more to know. Make sure to ask our doctor any additional questions you may have, as we'll be happy to answer your questions promptly and thoroughly. Thank you for watching our video today. Good luck, and make sure to like and follow us if you want to see other videos. Take care.